This video shows the transition process of a face mask, surgical or procedural, to an N95 respirator. N95 respirators are used during aerosol-generating procedures. These procedures should be performed in an airborne infection isolation room, negative pressure room, whenever possible. Always check the most current posted guidance for what is considered an aerosol-generating procedure and guidelines for prioritizing use of negative pressure rooms. N95 respirators are also worn when obtaining an NP swab. Obtaining an NP swab is not an aerosol-generating procedure and does not require a negative pressure room. To don a new N95 respirator, perform hand hygiene with soap and water or an alcohol-based hand rub. Remove the face mask and place in a paper tray or emesis basin labeled with the provider's name. Perform hand hygiene with soap and water or an alcohol-based hand rub. Don the N95 respirator. Cup the respirator in one hand with top and bottom strings hanging. Cup the respirator to your chin. Place the top strap at the crown of the head, the bottom strap at the base of the neck. Smooth the metal nose piece on both sides of the face simultaneously, avoid pinching, and perform a seal check. To complete the donning process, don protective eyewear and gloves. N95 respirators can be worn for extended use. This means worn without removal or redonning between patients if the N95 respirator is not soiled, contaminated, or damaged. This includes after aerosol-generating procedures. N95 respirators may not be reused, doffed, and redonned if used in an aerosol-generating procedure. They may be reused if the N95 respirator is not soiled, contaminated, or damaged. Extended use is preferred over reuse. To remove the N95 respirator for reuse, exit the patient room and ensure the door is closed after doffing gown, gloves, and eye protection. Grasp the bottom strap of the N95 respirator at the back of the head and pull above head. Let the strap hang. In a sniffing position, keeping front away from chest, remove the top strap of the N95 respirator and place in a paper tray or emesis basin labeled with the provider's name. Perform hand hygiene.